Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department, joins me now. Good morning.
Good morning, ma'am.
Bring us up to date. The numbers seem to have gone down a little bit over the weekend, but I think you think maybe that's because testing is down.
That's right. I do. The numbers are down. I believe we had 237 cases reported yesterday. But if we look at that next chart over on the state's website, which shows the number of tests conducted each day, the numbers are pretty low over the weekend and in the couple days leading up to the holidays. So I suspect that we'll play a little bit of catch up here this week and probably into the next week as well.
Yeah, we're probably going to have to keep a real close eye on those numbers for at least 2 weeks after the holiday weekend. What are your thoughts on that?
Yeah, that's correct. We've seen since the beginning of this, every time we have a holiday weekend and the following week to 10 days, up to 2 weeks after, we start seeing a spike in numbers. And it's really alarming right now when we look at our hospital capacities and see that our ICUs in the county are virtually full. The hospitals are having issues with their own staffing and things like that. And now we're looking at, the holiday season and some of the most heavily traveled times of the year.
Right. Well, I guess some good news is that we have a new testing location that opened today. You want to tell us about that?
That's right. We did open a new testing location at our office at 18030 Foundation Drive in Noblesville. It's out in the north side of our parking lot in a new trailer. The sides of it have the logo that you see behind me, so it shouldn't be too hard to spot. It is staffed from 8:30 to 4:30 every day, and we're currently accepting online through the state's appointment portal.
Okay. All right, everybody's wondering what's the latest on the vaccines.
Latest on the vaccine is that Pfizer has requested their emergency use authorization. The 10th is when the FDA, the 10th of December is when the FDA actually reviews that and either approves it or disapproves it. If the EUA is approved, it's our understanding the federal government has it ready to distribute to the hospitals within 24 to 48 hours. And I've also saw a article this weekend that one of the airlines is already working with Pfizer to pre-position it around the county as well, or I'm sorry, around the country as well. So,
Wow.
Things to keep in mind is that the CDC, the State Department of Health, and the other big policymakers and decision makers have created a prioritized list of who gets vaccinated when. Top priority would be for healthcare workers, including the ancillary workers within the healthcare settings. The next group are the high risk categories, as well as those that live in communal settings. Then we get into further down the line into critical infrastructure and things like that, and then into mass vaccination of the public. The good news is that Dr. Weaver, the chief medical officer for State Department of Health, last week mentioned that they believe that we will begin mass vaccination of the public as early as Q3 of next year. So that would be summertime, which would be amazing for us.
What role will the health department play in the vaccines when they arrive?
So for phase 1A and phase 1B, we are a support agency. We're supporting the hospitals. We're supporting those healthcare facilities like that. Phase 2, when we get into critical infrastructure and into phase 3, we will play a more predominant role in that. What we're hoping to do is engage every primary care provider in the county, every pharmacy in the county, basically any place you would normally go to get a vaccine, and hopefully we can get them on board to provide vaccine. So you would go to your primary care provider if that's the most convenient for you. At which point, again, we're playing a support role for everybody. That's our hope.
Fantastic. Anything else you want to add? Any thoughts that you want to leave everyone with as we head into the week ahead?
We're kind of, I feel like we're on a precipice right now. Hopefully everyone did the right thing and kept their gathering small. The thing is to monitor yourself for symptoms. If you are sick, stay home. If you have symptoms, go get tested and stay home until you get your results. And, if needed, seek medical attention. We will get someone to take care of you in the hospital setting if need be. So please, if you have any of the symptoms, stay home.
Fair enough. Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. Thank you. We will check
Thank you,
back in
Kim.
with you again next week.
Thank you.